I shall be demonstrating the exercises that you can do at home to help your knees be pain-free, stiffness-free, and also reduce the swelling. Did you know that the knee joint is one of the strongest and the largest joint in the body? It is the hinge between the two extremities of the leg. So it's very important to have good mobility around our knees. Now the first step to start exercising is through warm-up. And how do we do that? Warm-up can be done by stretching the muscles around the knee. There are two huge muscles that we need to focus on to stretch. That is the front of the thigh bone, which is the quadriceps, and the back of the thigh bone, that are the hamstrings. Now we'll start with the stretches for the hamstrings. All you have to do is sit on a comfortable position on a chair or sofa or wherever, and then lift your leg, place your leg on a stepper and try to take your toes, pull your toes towards you. Hold this position for 10 seconds to 15 seconds. And if you want to increase the stretch, you can go forward and try and touch your toes. Hold this position again for 10 seconds to 15 seconds and come back to the starting position. Try to do it on both the legs. I have placed my foot on a stepper so that it's visible. You can place your foot down on the floor as well. I've placed the other foot on the stepper. I'm pulling my toe towards my body, and see to it that your knee isn't bent. If it's bent, you won't get the stretch. Your knee has to be fully extended, and just pull your toe towards you, you will get a good stretch. Lean forward to increase the stretch, and the more forward you go, the more you get the stretch. Hold that position for 10 to 15 seconds and relax. Try to do this first stretch for at least twice on both the legs, 2 times on the right, 2 times on the left. Hold it for 10 to 15 seconds. The next stretch is for the quads, that is the muscles in the front of the thigh. You can do the stretch in 2 ways. One is by lying on the bed. I'll demonstrate this first. Lie on the side, bend one leg and pull your leg towards your buttock area and try to pull your knee behind. And hold this position for 10 to 15 seconds. And bring it back to its original position. If doing this in the bed is difficult, you can do the same stretch in standing position. That is, grab your ankle and pull it towards your back. Hold it for 10 to 15 seconds and relax. Again, do this twice, hold on both the legs and hold it for 10 to 15 seconds. Now that we've warmed the major muscles, we'll start with a bit of exercises. This is the second step. I want you to first sit on the bed or sofa which is comfortable, and we'll do the movement in which we have to pull our leg outwards and bring it back. So push your leg forward and back. This is the first exercise to increase movement and reduce the stiffness. Similarly, we'll do it on the other leg as well, and back. Lift it on top and back. Repeat this exercise for 10 times on both the legs. Since we've done the first movement easily without any difficulty, if you want to improve the strength, you can add a bit of weight across your ankle and do the same movement. Now you increase the strength only when your movements are pain-free. If your movements have pain, do not go ahead with the strengthening program. Also, it's advisable to consult your physios to know if you can proceed with the next exercise, that is the strengthening phase. For the second exercise, you can lie on the bed on your tummy in a comfortable position. And all you have to do is bring your heel towards your buttock and then bring it back. Repeat this 5 times to 10 times and back Similarly on the other leg, and back. Bend your knee and back. If this is too easy for you, you can increase the strength by placing a weight cup, or you can use a band, a resistant band, to improve the strength of your knees. But again, it is advisable to consult your physiotherapist. For the third exercise, I want you to stand and go across the wall so that your back is fully supported against the wall. Place your foot in a comfortable position and place it slightly forward. Your toes has to be pointed straight ahead. I want you to slide down. You can hold your hands across your knee or you can hold your hands front. And if this is difficult, try to hold across a railing or go across the wall completely so that you have some support. So all you have to do is your back against the wall, toes pointed forward, hold against the surface and your back completely rested with the wall, and just slide down. Hold this position for 10 to 15 seconds and back. Now the important thing to remember when you do this is your knee position. If your knees are bent outwards, that's a wrong technique. If your knees are bent inwards, that is again a wrong technique. It is essential that your knee and your toes are in line with each other. Hold that position for 10 to 15 seconds. If 10 to 15 seconds is too long for you, start by just going down and up, down and up. And gradually when this becomes easier, you can start holding the position. For the fourth exercise, I want you to stand in a comfortable position. Your feet placed wide apart, one toe pointed towards the right side. Let's start with the right side first. The next thing is face towards the right side and just lean forward. See to it that your knee and your toe are in line and come back. Easy? You can place your hands across your hip, just forward and backward. Similarly, we'll do on the other side. If we are doing on the left, your toe points to the left, your body slightly leans towards the left, and then just go forward and back. The important thing to notice is the leg at the back. It shouldn't be bent, it has to be straight. Just lean forward and back. Now again, you can start this by just leaning forward and backwards, and then to increase the strength, you can hold the position for 10 to 15 seconds. Repeat it 10 times for both the legs. The last step to complete the exercise routine is to cool down the joint. You can do that by placing an ice pack around your knees for 10 to 15 minutes, and make sure that the ice pack is wrapped around a tea towel or a thin cloth, just so that you don't have skin burns due to the ice pack. Hope this information helps, this video is helpful to you, but do not forget to consult your physiotherapist for better inputs as to how it can help you further. If you like the content, please like, subscribe to our channel. Take care and bye-bye.